Hello, welcome back to Simply Women's Health with CJ. Quick shout out to those of you who have left comments, questions for me. I do appreciate you. Today we're going to focus on week 15 of your pregnancy. You are now in your second trimester. Those hormone levels are continuing to taper off. You're probably noticing an increase in your energy level, your appetite. You may not feel 100% perfect yet, but you should feel better than you did a month ago. Your uterus is now about 4 to 5 inches below your belly button, so you may be having some cramps. Those cramps are called Braxton Hicks. They are very normal. If they are bothering you, drink some water, empty your bladder, get off your feet. That usually makes them go away. You may have twinges or round ligament pain. Every time you make a sudden movement, you get a pulling sensation down deep in your pelvis, and it can take your breath away. It is perfectly normal. Inside that uterus, your little one is now measuring approximately 6 inches long, or roughly the same size as a jalapeno pepper. Your baby now weighs just over 4 ounces, or about the same as a half a stick of butter. This week, the baby's taste buds are forming. Please don't worry, your baby cannot taste the foods that you're eating. The bones are starting to harden. The baby is sucking his or her thumb, yawning, stretching, and smiling. The heart is beating 120 to 160 times per minute, and that baby is extremely active. Some of you may be starting to feel flutters at this point. Again, if this is your first baby, it is very normal if you don't feel flutters yet. You probably will within the next few weeks. If you have a prenatal visit coming up this week, you will be able to hear the baby's heartbeat with a Doppler. Your provider might offer you a genetic test called an alpha-beta protein. It is a time-sensitive test. It has to be done between 15 and 21 weeks. The purpose of this test is to see if your baby is at risk to have what's called a neural tube defect. It is a screening test. It doesn't provide a diagnosis. You will probably also schedule your anatomy scan. That is a big ultrasound where they look at the placenta, the cord, they look the baby over head to toe to make sure everything looks perfect. That is usually scheduled between 18 and 22 weeks of pregnancy. So what should you be doing at this point? Stick to that healthy diet. Now that you're in your second trimester, you do need an extra 340 calories a day, which is about the same as a half a sandwich and a glass of skim milk. I encourage you to exercise. Nothing flat on your back. Maintain excellent hydration while you do. Make sure you're drinking plenty of water. If you are thirsty, you are dehydrated. I want you to take a prenatal vitamin every single day. Go ahead and have sex unless you've been instructed not to, and by all means, take that vacation. What shouldn't you do? By all means, take that vacation. Remember, you're not sick, you're pregnant. Live your life. The only things you shouldn't do: drink, smoke, or use drugs, change kitty litter boxes. You shouldn't eat deli meat. That's any meat that comes from a deli. No unpasteurized cheeses. Those are those soft cheeses that smell like feet. And no raw fish. If you have questions, I would love for you to leave them in the comment section below. While you're down there, go ahead and tap that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.